Unoxygenated blood returns from the body via the superior and inferior vena cava, draining into the right atrium. From the right atrium, it travels down through the tricuspid valve and into the right ventricle. Blood is pumped from the right ventricle out through the pulmonic valve into the pulmonary artery on the way to the lungs, where we exhale Kotwo and inhale fresh Otwo. After the blood is oxygenated, it makes its way back to the left side of the heart. Blood enters the left atrium through the pulmonary vein. It drains down through the bicuspid valve, mitral valve, to the left ventricle, and is pumped to the heart through the aortic valve, semilunar valve, to the entire body, where nutrients and fresh oxygen replace waste products and carbon dioxide.
Q&A.
Which blood vessels carry blood to the right atrium? Inferior vena cava and superior vena cava. Which valve allows blood to flow from the right atrium to the right ventricle? Tricuspid valve. Through which valve does blood leave the right ventricle to enter the pulmonary artery? Pulmonary valve. Which artery carries deoxygenated blood from the right ventricle to the lungs for oxygenation? Pulmonary artery. What is the circulatory system called that carries deoxygenated blood from the right side of the heart to only the lungs for oxygenation, and then returns oxygenated blood to the left side of the heart? Pulmonary circulation. Through which blood vessel does blood enter the left atrium? Pulmonary vein. Through which valve does blood flow from the left atrium to the left ventricle? Bicuspid valve, mitral valve. Through which valve is blood pumped from the left ventricle into the aorta? Aortic valve. Which blood vessel carries oxygenated blood from the heart to the entire body, where nutrients and oxygen are exchanged for waste products and carbon dioxide? Aorta. Which part of the circulatory system carries oxygenated blood from the left side of the heart to the entire body? Systemic circulation.